All right, welcome to the anatomy video for our knee. So when we talk about areas that are important here, we're going to need to sort of cover, there's a little bit of overlap, obviously, everything in the body is connected. So there's some overlap with some of the structures we talked about in relation when we were up in the hip. So our IT band is going to be very important. Our TFL up here, tensor fascia lata. We're going to be talking about our quads. So all of our quad muscles in the front. You've got your hamstrings in the back, right? So curl your leg up. We've got our adductors. So those are all of our kind of groin muscles on the inside. We'll get deep into those. And then kind of getting closer down into your knee. One really important muscle that we're going to talk about is, especially as it comes to balancing the knee joint, is the VMO. So this is your vastus medialis. Helps to keep the kneecap tracking in the right place. And then you have a bursa, right? So you've got, again, we talked about bursas when we were in our shoulder and in our hip. You've got your patellar tendon. This is your patella or your kneecap, right? And it's essentially floating. So it comes down and it just sort of floats and is encapsulated by all of the muscles of your quad. And then it becomes a tendon and attaches down into your lower leg bone. So it's just sort of hanging out here in space. And I'll show, but during the common issues, I'm going to kind of show you what can happen with patellar tracking issues, patellofemoral syndrome. But I want you for now just to kind of have a visual of the anatomy, how your IT band comes down, attaches, crosses the knee. And then the structures below that are, we're kind of getting into this more when we get into our lower leg and ankle, but some of your muscles, your anterior tibialis, your peroneals come up and attach. And then our calf muscles in the back become really important. You have your gastrocnemius, which crosses the knee joint in the back. And then your hamstrings come down and across the back of the knee joint. So both of those become really important in stability. And then I want to show you kind of the inside. So just to show you kind of what the meniscus looks like, these are the pads that are inside your knee joint. So if you look on the inside, so one bone comes up and the other bone comes down, and then you've got these two C-shaped pieces of cartilage called your meniscus, so medial and lateral meniscus. And when we talk again in the common issues section, you can get a tear in this tissue. So I just want you to know where these are. If you've heard somebody say, that they have a meniscal tear, that's what's happening. It's this cartilage in between the femur and the tibia as they come together in your knee. So they live right in this space in between. That's where your meniscus is. So I think that's kind of it anatomically for the important structures. And then I'll see you in the common issues video, and we'll talk about some of the things that can go wrong or happen in the knee joint.